We're at Blue Ridge HealthCare. We just started the virtual ICU today. So we're very excited about this new technology that we can bring to this organization as well as to our patients. So we went live today around 11:30, where we have the e-alert button at the bedside where the nurses can push it. And there's an intensivist that will be here from 7 o'clock at night till 7 o'clock in the morning. And then starting in January, they'll start coming on at 3 in the afternoon till 7 in the morning. And then we have nurses 24 hours a day that if we need anything as a nurse, and I know that we get busy and there's times that we need that extra set of hands, they're there. We push the button, they're there. They can check our blood with us. They can check our insulin if there's another nurse tied up. If we're in the middle of a code, they can do our writing for us and fax it to us. It's amazing.
So when we want to interface with the virtual clinical command center, we have a e-alert button. It's just a B button, a green button that we will push, and it will connect us live to the command center.
This is the camera where they actually monitor the patient, and then they should come up. See, they're zooming in on us. They can actually see us before we actually know that they're there, and what they're doing is they're making sure that they are looking directly at us.
It helps us to look at the patient from a different angle. We're able to see all their trends with vital signs.
They get it from the bedside monitor.
All vital signs, that's heart rate, blood pressure, everything, as well as their labs. And we're constantly getting alarms all day long to let us know if the labs are abnormal or critically abnormal. So we're able to alert the nurse and let them know, what's going on with the patient. And also we're able to alert the nurse if anything's going on with the patient and they're not in the room.
We're pretty pleased with how it's come this far, this fast. It's only been since May that we've been up, and now Grace will be the 8th facility that we've gone live with. And so far, obviously there's been some challenges, but things have gone as good as I could have hoped for, which has been nice. There's things that we can still definitely continue to improve, but it's gone pretty well. It's been pretty cool to see it come together like this.
ICU nurses, we respond to codes. So what if I'm up in a code? Who's watching my 2 patients on the unit? So there, you push the button. Michelle's gone to a code. Can you look over her patients? Amazing technology that we know that our patients are being watched after while we're not there.
You can see very well. We can see up to, if the patient was intubated, we can see the lines on the tube to show us where exactly it's intubated. One of the things that we can verify with the bedside nurse is insulin. And if you look at an insulin vial, it's very, very tiny, it's very small. So our cameras can zoom in and really get in a tight view to see how much insulin is going so that we can verify that with the bedside nurse.
It's an extra set of eyes watching the patients.
And their software actually operates differently than ours. So they get trending data on the patient all the time, and they see a larger scale picture in real time at once, if that makes sense. So sometimes they say that they can pick up on things that may be occurring that we can't even, that we're not picking up on yet, because they're seeing the big picture all at once.
We all went to a class. They came and talked to us and talked about when we should use it, and that we can use it as much as we want and as we need.
So you as a nurse, will you be the one that's clicking the button most of the time?
Yes. Yeah? Anyone can push the button. Family members can push the button. You can push it on admissions, discharges, if your patient's going down for an MRI. If we're in this room with an emergency and I know my patient across the hall tends to like to get out of bed, I can push that button and say, hey, can you watch my patient at 5:57 and make sure they don't get out of bed? And she can do that for me and communicate with me that, yeah, they're still in the bed, they're doing great. We have 10 beds on this side of the hospital, and there's an extra 6 beds, so 16 altogether.
Every single one of our ICU beds will have this capability.
Yes, they have this monitored feature.
So you come to Grace Hospital at no extra cost or anything to the patient.
That's correct.
You just have this awesome new technology.
And we don't charge the patient. This is something that the hospital is paying for because it benefits the patients in the end.
It's an investment in patient care.
And safety and quality of care, because you've got her watching our patients too, along with our nurses, and then their physicians and our physicians. And in the night, it helps the nurse get access to a physician very quickly because they're there and they can ask them. And they do the physicians round. They have an acuity system that's assigned to the patients, and so the physicians round on the higher acuity patients throughout the night.
Right.
And they video in, look at vent settings and things like that too.
All the bases are covered all the time, correct?
All the time, yeah. And what they see is we actually got to go down to Mint Hill and see the way the setup was. Amazing. So the nurse sits there and she's in a pod with all these screens. And so she looks at trends. So they don't actually look in the room. They never monitor in the room the whole time. They may look in if they see something's wrong with the patient, or the patient's off the monitor, or that kind of thing, or what's going on. But they look at trends, and if they notice, like, oh, look, this lab went down, or this vital sign's going down, maybe we need to see what's going on, maybe we need to call the nurse, you know, that kind of thing. They look at more trends because they're monitoring 30 to 40 patients.
I still do full-time pulmonary and critical care up at CMC Northeast, and all the docs that come through here still do bedside work, and we've asked them that they keep their skills up at the bedside because I think that's a must, just like the nurses do. The nice part is, you know, the technology's cool. You know, it lets us get a lot of data very quickly to get a quick view of the patient, but in the end it's still managing a critically ill patient, which when you see, and I've been training 25 plus docs that come through here, and that's what they really enjoy, is that they're still managing the ICU patient, and it's still, you know, similar in that aspect. There's multiple ways that we get alerted within seconds. You know, obviously we have, between the physician and the nurses, we're often looking at the waveform on the monitor continuously, and we'll see a change in the rhythm as soon as it happens, or within seconds. You know, we'll be happen to have it up, we'll take a look at it, and we're the ones that can alert the bedside nurse immediately. There's also another screen in this Philips system on this side that triggers us if somebody falls outside of preset parameters, you know, multiple times. We're going to catch that fairly quickly, and again, it also allows us to do it quicker and to look at a high volume of patients as well.
I can't begin to express my feelings about where the direction that this organization is going in regards to us being, you know, affiliated with Carolina's healthcare system. It's been amazing, the advances that we've come, the places that we're going to go. We're going to continue to get there. You know, our mission is to be the best healthcare system in America, and we're on that journey.